presenting for, hang on, let's start that again, guys. We are pleased to have Jodi Peacock today from NFH presenting for us. She's going to be talking about the pain and inflammation in the system and how to modulate that, along with new products from NFH that we haven't heard about. So it's something that should be really informational for us, and it's something that we're hoping you guys will enjoy. So on that, I am going to give it to the lovely Dr. Jodi. And if you have any questions, please let us know at the end and we'll be able to answer them for you.
Thank you so much for the introduction. And thanks for hosting this and organizing things. With NFH, we are obviously a Canadian-based company. I have been working, I'm just going to get this presentation going. There we go. I'm a CCNM graduate, so from here in Canada, 2006. I've been in clinical practice since then in Oakville, Ontario. I have been working with NFH since 2008, and I'm also the founder of the Canadian Fertility Show, so a big focus in kind of women's health and fertility. Today's topic, we are going to be really focused on inflammation and inflammation modulation, so all different kind of products that relate to that, but also happy to answer questions as we go through. Feel free to unmute, pop in, ask questions. I'm happy for it to be as interactive as you guys who are attending would like it to be. So for those of you who aren't as familiar with NFH, we are governed by Health Canada here. So there is a bit of a different regulatory system than in the United States, where we have to apply for what are called natural health product numbers. As part of that, we do have a very high level of quality control and insurance with all of our ingredients. So all of our raw materials get third-party tested, as do all our final products. So if you ever have, questions from patients or questions yourselves about kind of that quality piece, please feel free to reach out to Amanda, and she is able to get those certificates of analysis for you. In today's presentation, we're just going to kind of start with just basic assessments, general recommendations for patients, and then get into kind of the supplement options, and then we'll have lots of time for questions at the end. So in terms of just generally when patients are coming in, you want to have a really good kind of base level question period around what's happening with them. When did the pain start? What's the quality? Things that make it better or worse. Running some baseline lab values can be really helpful. Obviously, if you're not entirely sure where it's coming from, just getting some ideas of CRP, ESR, interleukin-6 can be helpful. In some patients, I might run an omega score if I think that might be playing a role. Also, again, depending on the type of pain, a hormone assessment may be applicable if we're talking more about things like endometriitis or endometriosis, fibrocystic breast, things of that nature. Now, when we are starting to treat pain, we need to really know kind of what it is that we're treating, because then it's obviously going to make it a lot easier to choose what type of treatment options are going to be best for them. So is it just that they have really tight muscles, they're sore? Do they have ligament or tendon damage, broken bones? Are we looking at joint pain? If it is joint pain, is it osteoarthritis? Are we looking at rheumatoid? Is it potentially another autoimmune condition? Often Crohn's, for example, will present with joint pain. Is it more kind of a female origin, endometriosis, uterine cramping? Nerve pain is another big one that I often find isn't well, often patients that are presenting with nerve pain don't get a lot of answers through the traditional medical system. So this, is something that we can obviously look to offer more kind of nutrition to that nervous system and help with nerve growth factor production. So those can be some of the things that we can help address with supplementation. Now, when we look at something, as basic as kind of magnesium, we know a good percentage of the population is deficient in magnesium. So, some of the things a patient might present with would be things like muscle stiffness, soreness, cramping, having a hard time relaxing into sleep. Some of our migraine patients are going to be magnesium deficient. Definitely premenstrual syndrome can have a link with magnesium. And with our magnesium, bisglycinate has got 150 milligrams of elemental magnesium in that bisglycinate form. So it is a form that's going to be more easily absorbed from the gastrointestinal system to address some of these concerns. So, sometimes I'll use it just for my athletes if they, have had a really hard workout and they know they're going to be really stiff for the next few days, take a couple of capsules before bed. With magnesium, if you kind of overdose with it, you will end up with a loose stool. So you just have patients watch for that. If their stools are waking them up in the night, they need to back off their dosing. But again, with the bisglycinate form, because it doesn't hold as much water in the bowel, you can typically dose it higher than you can some of the other magnesium forms on the market. Now with ginger, most people know this herb more as an anti-nauseant, but it actually does have some quite strong anti-inflammatory effects, specifically through COX-2 inhibition. So with ginger, there was one trial where they compared using ginger to sumatriptan for acute migraine pain. They dosed either the 250 milligrams of ginger or the 50 milligrams of sumatriptan at onset of pain, measured pain analog scale 2 hours afterwards. And they found that the average patient in the sumatriptan group improved 7.1 on a 10-point scale, where in the ginger group, the improvement was 6.7. So not quite as effective, but actually quite close. And the nice thing with ginger compared to sumatriptan is the side effect profile is significantly less. Most patients don't experience any side effects at all from it. There can be the odd patient that can get kind of a heat through their system with it, because it is a very warming botanical. So for those of you who are trained in traditional Chinese medicine, we know this is a very yang formula. So if somebody is already kind of that really hot, fiery patient, they might feel a little bit too much heat from this, but outside of that, really no side effect profile, very safe. It's obviously safe in pregnancy. There's no known drug interactions. So that's a really positive thing with this. There's also some research using it for dysmenorrhea or painful periods. When you look at the trials that they did with this, they just started it on kind of day 1 of the menstrual cycle when cramping started. And dosing was anywhere from 2 to basically 6 capsules. I do find for patients with this one though, if they have a regular menstrual cycle and they typically have that more intense cramping on day 1, if they start the ginger a couple days before their period, so at either 2 caps twice a day, or sometimes even 2 TID for that 2 or 3 days before their period, often that really reduces the amount of cramping and pain and can reduce their reliance on other pain medications for that time, and make them more functional so that they're able to go to work, things like that. So even in patients with endometriosis or just really painful cramping, this can be a really nice option for them. With NEM, this is a product called natural eggshell membrane. With NEM, it has some quite large clinical trials specifically for patients with osteoarthritis. So it can help with kind of the pain, stiffness, range of motion, all those concerns that can be associated with OA. In the trials, there was one with OA of the lumbar spine. There was another one with OA of the knee. Patients were dosed at 500 milligrams a day. So the nice thing about this is it's only 1 capsule a day for them. And within 10 days, about 70% of patients in the active arm of the trials did see some improvement in these different parameters. Maximum benefit was at about 2 months. So not everybody responded right away. And if somebody hasn't seen anything within 2 months, it's probably not going to be that helpful for them. It looks like it can have an impact on TNF alpha levels. And then with kind of use of this, we do put Boswellia in the capsule. Basically, instead of filling it with something inert, we filled it with Boswellia, because Boswellia does also have some quite good research around osteoarthritis. We do have a separate Boswellia product that you can supplement on top if you want to hit more kind of therapeutic dosing with the Boswellia. But even at this level, we do see some alleviation of pain for patients. So again, with Boswellia, this can be really helpful for your OA patients, but also some good research with rheumatoid arthritis patients as well. Here, dose of 3 capsules per day for 8 weeks, saw decrease in pain levels, decreased swelling, improved range of motion, and better walking distance. The other nice thing with Boswellia is we know with longer term use, you can actually start to see changes on radiographs. So for patients that have been in for x-rays, they've seen there's a lot of degeneration in the joint. There was one trial that looked at Boswellia over a 6-month period of time, and they actually saw at the end of the 6 months, the radiographs looked better than they did at the beginning. So versus, taking, a Tylenol arthritis or whatever other pain medication, we know that can obviously blunt the pain response, but we don't see any improvements for them. We know that's just more of a Band-Aid approach, where with kind of that longer term use of Boswellia, we can actually see some improvements. You can also use Boswellia for helping patients with IBD disorders, so Crohn's, colitis. There was a trial that showed patients that used Boswellia maintained remission longer than patients who didn't, as well as being able to use it for helping to support neuro recovery. So traumatic brain injury, we saw improvement in cognitive outcomes with Boswellia, and that would be at the equivalent dosing of 2 capsules a day. Now, in terms of kind of how it works, the boswellic acid does inhibit the 5-lipoxygenase and suppresses leukotriene synthesis. So we're kind of hitting that inflammation cascade in 2 different ways when we're using Boswellia. Now, curcumin is obviously an herb that most people are pretty familiar with and aware of. We do have 2 different SKUs of curcumin. So the Curcumin SAP is your more standard 95% curcuminoids option. And then we do have a water-soluble version, the Curcumin H2O. We know curcumin, again, can be really helpful from an inflammatory standpoint. There is good research using it for helping with rheumatoid, with osteoarthritis, also has some neuroprotection as well. And with curcumin, it's working more on your COX pathways, your 5-lipoxygenase, and it can help reduce PG2 as well, so that prostaglandin synthesis. So we're seeing a little bit of a different mechanism of action compared to Boswellia. And so depending on what inflammatory markers you're looking to modulate, you may choose one versus the other. The other kind of piece that I often will use to differentiate if I am looking to just use a single herb, typically if the patient tends to go more to the acetaminophen or the Tylenol as their pain reliever, normally I'll start with curcumin for them, because curcumin also has that really protective effect for the liver, where if there's somebody who tends more to the NSAIDs, the anti-inflammatory options, I might then choose Boswellia as my starting point, because with Boswellia, it's definitely more protective for the GI system, which we know can have some negative impact from some of those anti-inflammatory pharmaceuticals. Now, in terms of dosing with curcumin, this one trial looked at using 1,200 milligrams. It was as effective as NSAIDs at controlling inflammation post-operatively. So that would be kind of the equivalent of 3 capsules a day for the patient. And then same dosing was used compared to phenylbutazone, which is another NSAID that is often used in rheumatoid arthritis patients. And again, saw very similar inflammatory control for patients. In terms of kind of choosing one versus the other, I typically will use the curcumin H2O because we're going to get better absorption out of the gastrointestinal system than from the 95% curcuminoids in any of the conditions that are more systemic. So if I'm using it for joint pain, for liver support, those kind of things, where if I want the curcumin predominantly in the gastrointestinal system to have a more localized effect, so for IBD patients, IBS patients, leaky gut, anything along those lines, I typically will use the 95% in those cases. With quercetin, this is obviously a bioflavonoid. It predominantly gets used as, a support for patients that are having allergies. It helps stabilize the mast cells to reduce the amount of histamine that gets secreted. So it can be a really helpful adjunct for any of your patients that are dealing with kind of a high histamine response. In terms of its ability to help with inflammation, we also see an inhibition of phospholipase A and 5-lipoxygenase with this as well. We do know also that this does help to modulate some of the replication of different viruses. So this is something that has been used a lot more kind of over the last 18 months during the pandemic, because there was a trial that showed it could inhibit the replication of the COVID-19 virus as well as some others. So this might be something that, if somebody's dealing with allergies or they're dealing with inflammation and they're also, concerned around COVID, that this could be a really good fit for them. Now with the Inflacom, this is more of kind of the kitchen sink approach to inflammation. It has curcumin, quercetin, boswellia, all together in here. And then we also have some of our proteolytic enzymes, so rutin trypsin and some steroidopeptidase. So with this combination, obviously you have the botanicals that are going to modulate those different aspects of inflammation that we've kind of talked about through the last few slides. And then with the addition of the proteolytic enzymes, these are really going to be helpful for scar tissue formation, for inflammation in our vessels. So this is something that I often will use, post-surgically as an option. It's great for acute edemas though. So if somebody sprained their ankle, if somebody has tennis elbow, also can be used obviously in your IBD patients. Both curcumin, boswellia do have some good research there. And then even for just more kind of chronic inflammatory things like sinusitis, it can be a really helpful addition for. And so obviously we're kind of modulating that lipoxygenase, your COX, and your prostaglandin synthesis, because we have that impact from each of the different individual nutrients. It does come in a enteric-coated capsule, so then you're protecting the proteolytic enzymes through the stomach, so they're not going to get all broken down. So the nice thing about that is you don't have to tell people to take it away from food, which I just find makes compliance generally a lot better. Now you can take it empty stomach, that's fine to do as well, but it doesn't have to be empty stomach. With black cumin seed, this is one that I find does not get used very often where I am anyway. I'm not sure about for you guys on the West Coast. Black cumin seed is an Ayurvedic herb, so it's used predominantly in Indian culture. It has some amazing clinical trials though, from an inflammatory and antioxidant. There's also, pretty good research from a cancer standpoint. There's trials using it for Hashimoto's thyroiditis and showing antibody lowering, TSH lowering. And it has an impact on several different pathways when it comes to inflammation. So it can help modulate TNF alpha, NF kappa beta, some of your Th1, other cytokines, your interleukin 4, 5, 13. So, all of these different inflammatory cascades can really get minimized with the use of black cumin seed. It does have some specific research around allergies as well. So again, if you're kind of like, oh, this person is presenting with, an inflammatory process, they also have Hashimoto's and they have allergies, this is such a great fit for those patients. I also find I've been using this in patients post-vaccination. So I don't know if you guys have been seeing this, but in several of my patients post-vaccination, I've been seeing elevated CRP levels, elevated TNF alpha levels. So this has actually been quite helpful at modulating that and bringing it down. I often will combine this with the water-soluble curcumin together in those patients. and have seen some pretty good results with that. Now, I don't think we can talk about pain and inflammation without talking about fish oils. The Trident 6633 is kind of our standard 2-to-1 ratio fish oil. It's got 660 milligrams of EPA with 330 milligrams of DHA. And we know both EPA and DHA do help shift synthesis away from that inflammatory eicosanoid pathways, right? So talking to patients about switching some of their dietary preferences, so they're not always eating animal-based proteins and eating more fish is going to help that as well, because that's going to help kind of swing some of that balance from the arachidonic acid that they're getting a lot of in their animal products, and getting more from their fish. If they're eating more of a vegetarian type diet, obviously that's also going to help reduce the arachidonic acid. But in terms of kind of EPA, we know it produces PGE2 and LTB5. So both of these are systems that help reduce the duration of inflammation. DHA helps decrease the cytokines TNF alpha. It also helps reduce CRP. So this is going to be another kind of important piece when we're looking to help modulate that inflammatory cascade. And generally speaking, when we're looking at anything inflammatory, your therapeutic dose is about 3 grams a day. So with this product, that would be 3 capsules. If you're using a liquid, that may be somewhere between a teaspoon to a tablespoon, depending on the product. Carnitine is something I find doesn't come up very often when it comes to pain management or inflammation. But we know that a carnitine deficiency can present with muscle pain. It can present with fatigue. We often see it, come up as deficient in patients that have any kind of mitochondrial dysfunction concerns. So whether that's fibromyalgia, chronic fatigue, patients that kind of present as never well since often have some mitochondrial toxicity. So with carnitine, basically what it does is it opens up the pathways to let fatty acids move from the bloodstream into the mitochondria. So if you're dosing someone with CoQ10, for example, because you're using it, from a fertility standpoint, someone's on a statin drug, if they're deficient in carnitine, that CoQ10 has a really hard time actually getting into the mitochondria and having that positive benefit on energy production for them. So this is something that, again, I find often gets overlooked and is underutilized in the naturopathic community. It, from a pain standpoint, we can see carnitine help with things like angina, intermittent claudication. The difference between the two types, acetyl L-carnitine has the ability to cross the blood-brain barrier, where carnitine tartrate will stay in circulation more. So when we looked at trials with fibromyalgia, for example, it's quite interesting. There was one trial where they put patients on kind of one version of carnitine, did a 2-week washout, then put them on the other version to see what impact it would have. And they actually saw that patients, while they were taking the carnitine tartrate, had an improvement in like pressure point, pain point, stuff like more kind of the physical within the body symptoms, where when they were switched onto acetyl L-carnitine, they saw more of a difference with kind of the mental fog, fatigue, that way. So oftentimes with those patients, I will put them on a combination of both forms so that we are kind of getting carnitine both in the central nervous system and within the body as well. Now, nerve support is a combination that helps support peripheral nerve function. We do see it help with nerve growth factor production, and it's a combination of the acetyl L-carnitine that we just talked about, benfotiamine or B1, R-alpha lipoic acid, B12, and B6. So basically all the different nutrients that are fairly specific to helping support and nourish our nervous system and nerve repair and healing. So with this combination. You can use this for pretty much anything nerve related. So could be for peripheral neuropathy after surgery, dental pain, herniated discs. I had one patient kind of soon after this product had come out for us that presented to the office as, you know, a new patient. He had suffered a stroke about 10 years before coming in. And one of his kind of chief complaints that he still had from the stroke was this like pulsing, buzzing, like really irritating sensation down his left arm. He had tried, you know, things like gabapentin, Lyrica, some of the other pharmaceuticals that are offered for neuropathy and nerve pains, and none of them made any difference for him. So I suggested trying this. I was like, I don't know if it's going to help. You know, there's really nothing in here that's going to be harmful for you. So let's kind of give it a try and see. He dosed it at 2 capsules a day for 6 weeks, and we followed up. And when he came back, he said that sensation was gone. And, you know, that was a 1.5 years ago, and it still hasn't come back for him. So it's, you know, a pretty amazing thing for him, because now he can sleep better. He's able to function a little bit better with that left hand and arm. So definitely kind of anything nerve related, I would think about this. Now, I will say that nerve, you know, in my practice anyway, I find it can be very challenging to treat. You know, what one person responds to, the next person doesn't at all. But again, because of the high kind of safety profile and there's really no risk, I think it is something that, you know, can be worth trying, because for the patients that it does work well for, it's game changing for them. Then from a medicinal mushroom standpoint, we do carry lion's mane or Hericium as one of our 8 medicinal mushrooms. With Hericium, it does also play a role with supporting nerve growth factor production. You can actually see with this mushroom that, you know, nerve that has been damaged can actually regenerate. So obviously, if it's been completely severed, that's not going to happen. But we do know it can cross blood-brain barrier and have an impact in that central nervous system. It also helps alleviate gastritis, so kind of that irritation through the stomach and through the rest of the digestive system. Some research from an immune modulation standpoint as well. Like, we know most of our mushrooms do have a supportive role that they play in terms of our immune modulating, but from a kind of a pain standpoint, definitely, you know, something to think about when it comes to our nervous system for sure. Now, looking at some of our newer products, we do have a product called Pain Relief, which is made up of PEA. So PEA is a fatty acid amine that's in the endocannabinoid family. It has been suggested that it can basically modulate interactions with mast cells. So we can see some of that histamine response similar to how a quercetin might work. The CB2 also basically works on the cannabinoid receptors. So for some patients that may have, you know, responded well to other cannabinoids in the past, this might be something that they look at as an option. Like, if they've done well with CBD, this might be something that is helpful for them. With the basically, I mean, when you look at kind of the receptor sites that it's working on, there's some antagonism with the GPR119. There's also an organ receptor involved in the glucagon-like peptide 1 secretion. So basically, based on kind of these different pathways that it can impact, we can see that it does have some anti-inflammatory effects, but also works as an analgesic as well, because it has these different routes that it's modulating that endocannabinoid system. So this is something that I will often use for more acute pain, things like somebody's complaining about a headache, or, you know, they've had something where they might reach for a, you know, a Tylenol or an Advil, you know, something like that. This is something that you can certainly try in those situations, but also for our more kind of chronic pain. There is research using it for like different types of things like metastatic prostate cancer, after back surgeries, different types of sciatica, carpal tunnel. There was one trial using it in endometriosis, and showing some benefit for our female patients that are struggling with that. There was one trial looking at using it for TMJ arthritis. That trial used 900 milligrams a day. So that would basically be the equivalent of 3 capsules of this particular product over 2 weeks, and saw a significant pain reduction compared to placebo. Can also be used for neuropathic pain. So again, it gives us another option, right? Like we know treating pain can be quite challenging for us. I'm just going to check so with the pain relief, it is safe with blood thinners. It can, on our label, it can have a mild blood thinning effect. If they're on a blood thinner, like a warfarin or a Coumadin, where they're monitoring INR, typically, with anything that we have that might cause some blood thinning, I usually will try to start it just a few days before they go for that INR testing, so we can take a look and see. If they're on one where they're not monitoring INR, I will just caution them and say, we could see some more thinning effects. Watch out for any, like if they're seeing a lot of bruising happening, from things that aren't obvious, like they don't remember kind of hitting themselves and they're showing up with bruising, that obviously can be a sign that we're getting too much blood thinning, and then we might back off dosing in that sense for sure. And in terms of the endometriosis, there is a trial that looked at using 400 milligrams of PEA, so just over kind of the dose of 1 capsule. And that worked quite well for them. Sorry, Scott. Now, Probio Mood is an interesting one. Like with probiotics, like obviously I'm not sure how long you guys have been in practice for, but they have really come a long way since, the 15 years I've been in practice. And with these 3 specific strains, so the Lactobacillus helveticus, rhamnosus, and then the bifidolongum, these 3 specific strains of bacteria have shown a significant improvement with mental health concerns. So with looking at the overall picture for someone, I don't think you're going to use kind of a probiotic as a standalone for someone with depression or with kind of generalized anxiety. But I think, oftentimes we are with those patients, obviously supporting their digestive systems. Oftentimes we see, digestive disorders go hand in hand with anxiety. So as you're kind of choosing what probiotic might be a good fit for them, I think this is a really nice way to help kind of support that GABA production, the serotonin production in the gut with these specific bacteria, as well as getting the digestive effects from them as well. We know with rhamnosus, it's one of our best for kind of immune balancing. So we're going to get that benefit from it as well. And certainly we can see it help reduce kind of stress-related GI complications. So those patients that find anytime they are getting more anxious, they're the ones that go and have to vomit, or they're having a lot of loose stools. They get, that painful piece. This is something that I would certainly consider, as kind of your base level probiotic in those patients. In one of the trials, they are relatively small. The one was 66 volunteers. They showed, after using this for a month, a reduction in psychological distress, lower anxiety and depression symptoms. There was another small trial, an open label, conducted with 10 people over a 2-month period. And again, here we saw improved clinical symptoms of depression and sleep quality during that time. So one of the questions that just came is, we often get asked if the Probio Mood is safe to be on with an SSRI. If they're feeling better on the probiotic, can they stop taking it, or will they need to continue taking it from here on out? I mean, with probiotics, it is something that I think we get a little bit of a mix of, do we need to stay on these long term? Can we stop them? Do they actually fix things? I think part of it does go back to looking at what was that person's original microbiome. I mean, we know up to about the age of 2, that's when kind of our core microbiome gets developed. So if that person's, microbiome originally was quite robust and healthy, and they, have had issues with the microbiome, in more recent times because of, changes in diet, high stress, that kind of thing, it could be something that kind of helps reset. So they use it for 3 to 6 months, and they may easily be able to come off of it. There's no interaction with an SSRI, so there's no concern with combining this with an SSRI. And if anything, I think it would be a really good idea to do that, because we know we want to modulate that microbiome in our mood patients. But, I think there will be patients that do need to use it ongoing if they weren't someone that had a robust microbiome to begin with early days. Now, Saffron is a really exciting new product for us. This, Saffron has basically 2 different active components with it. We have safranol, and then we have the crocins. With saffron, though, it can help manage more severe depression symptoms. It also helps promote cognitive function in Alzheimer's patients. So this is a really kind of exciting piece, because I don't find we often have a lot of options for those patients that are, dealing with Alzheimer's or other types of dementias. So, with this, the trials do show some improvement in some of those dementia symptoms, as well as in major depressive disorder, and kind of mild all the way to that major piece. In the clinical trials, there was a systemic review looking at 12 different trials evaluating the effectiveness of saffron on psychological and behavioral outcomes. They showed that saffron may improve symptoms and effects with depression, sexual dysfunction, and also excessive snacking behaviors. So for your patients that are more emotional eaters, this can be a really good potential option for them. There was another trial that, looked kind of at the general treatment with saffron, and found it compared fairly well to most of the antidepressant medications that it was compared to, and saw very similar efficacy. So in terms of how it's working, we do see some serotonergic effects. We also see neuroendocrine, neuroprotection, and then some inflammatory modulation as well with this option. So I know it isn't something that I don't think a lot of people have used for long periods of time. It has been difficult to get raw material sourcing for it. I know it took us about 4 years to actually find a good raw material source that passed all our quality control testing. So I know it's not that easy to obtain, but now that we have a good supplier for it, this could be a really good option for you for helping with these patients that are having mood disorders. And, particularly through this last 18 months, I would say mood disorders have skyrocketed here in Canada. And I'm sure you've kind of seen similar trajectories in the United States with all these in and out lockdowns and businesses shutting and things like that. It's been quite a challenging time for a lot of patients. Now, in terms of Alzheimer's, basically here it looks like it can inhibit the aggregation and deposition of amyloid B, which is one of the parts that looks like it plays a role in Alzheimer's patients. So if we can kind of stop that aggregation, we should be able to hopefully stop some of the progression in Alzheimer's patients. And then in one of the trials, so patients that kind of had mild to moderate Alzheimer's given 30 milligrams a day, so equivalent of 1 capsule. And they found at the end significantly better outcome on cognitive function compared to the placebo, and there were no adverse events reported with it. So that's also obviously a really important piece. When we look at kind of combining this can also safely be used alongside an SSRI or an SNRI if somebody is on medication for depression. So just so you know, it is safe to combine for them. Hawthorne is also a new product for us. With Hawthorne, it is predominantly going to be used for cardiovascular concerns. There was one trial that looked at using kind of 400 milligrams 3 times a day for diabetic patients. After a 6-month period of time, they actually saw a reduction in neutrophil elastase. So that's one of the biomarkers that we will look at for coronary heart disease. So if we can reduce it, it actually helps keep the vessels more pliable, which is obviously really important, particularly in our diabetic patients. In congestive heart failure, like class 2 congestive heart failure, 80 milligrams twice a day for 8 weeks, patients saw improved cardiac performance, so less shortness of breath and less ankle edema. In another trial where they ramped up the dosing significantly from that first one, so 200 milligrams 3 times a day, here they actually then started to see better exercise tolerance, a decrease in systolic blood pressure, and a decreased heart rate, where there was no change noted in the placebo group. So, you know, when you're thinking about your cardiovascular patients, if you're seeing kind of any of that congestion, if you're seeing a lot of edema, this might be one that you want to think about in those cases. With collagen, this is a hydrolysate. It's derived from a combination of both collagen 1 and collagen type 3. We know collagen is the primary component of, you know, various different connective tissues in the body. So we see it, you know, predominant amounts in our fibrous tissues. So things like our tendons, our skin. And overall, it does represent about 30% of the body's protein content. Lots of patients will get benefit from this for joint pain. So especially if it's OA related, here, you know, at a 1200 milligram daily amount, we saw after 6 months improved pain parameters compared to placebo. We can also see it help improve bone mineral density because it does help stimulate proliferation of osteoblasts. So a little bit of a different route to supporting that bone health compared to, you know, using your vitamin D and K and your calcium. When it looks at skin, we know it does help with skin elasticity. It helps with hydration. You know, over time, we do start to see collagen density in the skin reducing. So that's where we'll see kind of more wrinkles and dryness. So with adding the collagen in, we can start to see that reverse for patients. So obviously it can be a little bit more of a cosmetic application, but we do know that if your skin is not well hydrated, it's going to leave you more prone for infections and other concerns there as well. Helpful for muscle strength if somebody has sarcopenia. So again, for people that are, you know, more senior, they're having to be more sedentary, maybe because of pain or lack of mobility. This can be something that's quite helpful for them. It can actually improve kind of muscle strength, muscle mass, you know, compared to just doing resistance training on its own. And it does also help support a wound healing for pressure ulcers. So again, where patients are, you know, sedentary, they're not able to move, they're developing that, you know, and whether it's helping there because it's helping bring more hydration to the skin, which is going to make it less friable when you're kind of sitting on it all day long. I'm not sure the exact mechanism, but it definitely is something that can be helpful from that perspective. And then from a cardiovascular standpoint, there are some animal studies. So I haven't seen any in humans at this point, but that, you know, using collagen did show a decrease in systolic blood pressure by inhibiting the ACE1 pathway. So no cough or anything kind of associated with it in the animals. But again, I don't have any human data to back it up, but you may see some improvement there if you're using it for other reasons. Now, when it comes kind of overall to our pain patients, what are some of the other things that we can do to help support them? Certainly, we know breath work, meditation. I mean, we've seen the trials that have come out of Harvard. You know, even if somebody spends 3 minutes a day focusing on their, you know, their breathing pathways and kind of that mental calming for the system, that can start to change their neurology or their neuronal pathways in their brain. So I really encourage patients to just take that, you know, 3 to 5 minutes at least every day. If they can do more, great, but at least if they can kind of make that their minimum benchmark, that can be really helpful. Obviously supporting them through movement, you know, particularly with our OA patients. Often I'll find, you know, as they get older, they want to, it hurts to get going, so they don't want to. But sometimes we have to work through some of that pain, obviously within pain tolerance levels and depending on what the situation is. But we want to keep people moving because we know when we have better mobility, we have better longevity. So there was another question that came in. We've recently been working with a clinic that primarily focuses on EDS and connective tissue disorders. Would the collagen be effective to help these patients in their daily lives and comfort levels? Again, like because collagen is part of all those connective tissues, it's something I think would be worth trying for sure. And again, because there's really no kind of negative to using it, we know it makes up 30% of our body's protein content. I think it would absolutely be worth trying. And I'd love to hear if you do try it, you know, what the outcomes are in those cases. Obviously talking about diet, as naturopathic doctors, this should be part and parcel to pretty much any conversation we're having with our patients, but looking at reducing things that are going to promote more inflammation. So anything that's going to help us reduce insulin levels, so reducing our sugars, our grains, alcohol, those are all going to help take some of that insulin level down, which we know insulin is very inflammatory. Reducing just, you know, your processed foods, and then also, you know, gearing your diet more to, you know, your fish, your EPA, your DHA, your alpha linoleic acid, and away from some of that arachidonic acid in animal meats. I mean, I don't think you have to necessarily go all the way to a vegan diet. I think we can kind of strike a balance in there with most patients. Also looking at, you know, the nightshade vegetables. For some patients, I find they don't make any difference at all. And then for others, like I had one patient that had quite bad arthritis in her hands. She would grow a garden every summer and her arthritis would really flare up, you know, every July and August. And then we kind of started to piece together, okay, well, she's growing a ton of tomatoes. And so, you know, initially she kind of thought it was just worse because she was in the garden a lot more. But when we stopped eating the tomatoes, it actually got significantly better. So, you know, for some patients, those nightshades can really play a big role for them. Hydrotherapy, obviously a big one too. This is something that, you know, is easily accessible for a lot of patients, being able to do contrast showers. You know, encouraging more lymphatic drainage. Castor oil packs are huge for pain. They can make a really big difference for patients. And then also making sure patients are sleeping. Like if they're in so much pain that they can't sleep, we've got to address that piece for them because sleep is so critical to being able to heal and regenerate and restore. So, you know, really kind of that's one of my first focuses for people when they come in is addressing the sleep and obviously the digestion component here. But, you know, if you can help someone move from a state of high pain to even something more moderate, they're going to be a lot more likely to listen to you with some of the other recommendations and things that you might want to talk to them about. So, so that kind of concludes what the products that I was going to go through today. We've got a few minutes if anybody does have any other questions. I know we answered kind of some of them as we were going through, but if anybody else does have questions, please feel free. Or if something comes up after the fact, you're working with a patient, you can always email or give me a call. I'm happy to help answer questions and help work through cases with you.
It's a great time to be able to pick Dr. Jodi's brain too, you guys, because it's difficult to get a hold of her because she's so busy. So if you guys have questions, go for it. And if not, you're more than welcome to email me and we can get that information over to Jodi. Not a problem.
Perfect.
Thank you so much for your time, Dr. Jodi. We truly appreciate it. As always, it's lovely to work with you, and we thank you for your dedication to this industry.
Well, thank you so much again for having me. And yeah, again, if anybody has any questions, feel free to reach out.
We will see you at Doc Talks.
All right, sounds good. Thanks.
Thank you.
Bye.